Hi guys, I'm Kimberly C. Batohanon from Besen 2 Edenbach, and I'm going to perform Nasogastric tube feeding. Nasogastric tube feeding is an installation of specially prepared nutrients into the stomach through a nasogastric tube. Step number 1. Explain the procedure. It helps to allay anxiety, gain cooperation, and prepare the patient for what to expect. Step number 2. Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Step number 3. Prepare feeding container to administer formula. Have tube feeding at room temperature. Cold formula may cause gastric cramping and discomfort. Then, shake formula container well and fill container and tubing with formula. Step number 4. Place client in high Fowler's position or elevate head of bed 30 degrees. Elevated head helps prevent aspiration. Step number 5. Determine tube placement. Aspirate gastric contents to check gastric residual. Return as aspirated contents to stomach unless the volume exceeds 150 ml. The presence of gastric secretion indicates that the distal end of the tube is in the stomach. Measure pH of aspirated GI contents. Fasting gastric pH is usually equal to or less than 4. It is only infrequently greater than 6 in contrast. Intestinal aspirates usually have a pH equal to or greater than 7. Observe the aspirate's appearance. Gastric fluid usually cloudy and grassy green, or tan or off-white in color. In contrast, intestinal fluid is usually deep golden yellow and it's clearer than gastric contents. Consider the results from pH testing and the aspirate appearance together. An aspirate with low pH and a typical gastric fluid color indicates a high probability of gastric placement. Step number 6. Initiate feeding. Bolus or intermittent feeding. Pinch proximal end of the feeding tube. Prevents air from entering client's stomach. Remove plunger from syringe and attach barrel of syringe to the end of the tube. Fill syringe with measured amount of formula. Release tube and hold syringe high enough to allow it empty gradually by gravity. Refill, repeat until prescribed amount has been delivered to the client, and allow bag to empty gradually over at least 30 minutes. It reduces the risk of abdominal discomfort, vomiting, or diarrhea induced by bolus or too rapid infusion of tube feedings. Step number 7. Advance tube feeding gradually. To prevent diarrhea and gastric intolerance to the formula. Step number 8. When tube feedings are not being administered, cap or clamp the proximal end of the feeding tube. Prevents air from entering stomach between feedings. Step number 9. Administer water via feeding tube as ordered with diluted formula. It provides client with source of water to help maintain fluid and electrolyte balance. Step number 10. Rinse bag and tubing with warm water whenever feeding are interrupted. Warm water all tube feedings and reduces bacterial growth. Step number 11. Measure amount of aspirate, residual, every 4 hours. Evaluates tolerance of tube feeding. Step number 12. Monitor finger stick blood glucose every 6 hours until maximum administration rate is reached and maintained for 24 hours. Alert nurse to client's tolerance of glucose. Step number 13. Monitor intake and output every 24 hours. Intake and output are indication of fluid balance or volume excess or deficit. Step number 14. Weigh client daily until maximum administration rate is reached and maintained for 24 hours. Then, weigh client 3 times per week. Indicator of improved nutritional status. Step number 15. Observe the return of normal laboratory values. Improving laboratory values such as albumin, transferrin, and prealbumin indicate an improved nutritional status.